Welcome back, students, for the second video on the Viva of the mandible. Okay, the mandible, as I said, is very important bone and very frequently asked in Viva. Now, in this video, we will learn what are the relation of the nerves, vessels, ligaments, and the attachment of the, the relation of the glands and attachment of the ligaments in relation to that of the mandible. Let us see if he is asking, if the examiner is asking you the question that, so the relations of the various glands of the mandible which are in direct relation to the bone. You may say that here just above the mylohyoid line there is an area which is in relation to that of the sublingual gland, salivary gland, that this flat area, okay, this very close to the symphysis manti, okay, near the midline, this flat area is in relation to that of the sublingual gland, while a depression here deep to the mylohyoid line and the groove near the border or the base of the mandible, it lies here in relation to that of the submandibular salivary gland, and then near the posterior border of the ramus of the mandible, okay, there is the parotid gland. So three different salivary glands, they are in relation to that of the mandible. Okay, parotid may be little away, but these two glands, submandibular and sublingual, they are directly in relation to it. Then there may be a question, so the attachment of the muscles of mastication, okay, these muscles of mastication, you can show that these are the muscles which are gaining the insertion on this, that is to the anterior margin of coronoid process and the inner surface of the close to the anterior margin on the internal surface. This muscle which is attached here is the temporalis, insertion of temporalis. Then onto the outer surface of the ramus of the mandible, just above the angle of the mandible here, this muscle which is gaining attachment is the masseter muscle, okay, the second muscle of the mastication. Then there is another important muscle which is attached onto the pterygoid fovea, okay, in front of the pterygoid, this condylar process or the head of the mandible near the neck. This depression gives attachment to the ligament, to the tendon of the pterygoid muscle, okay, lateral pterygoid muscle. And the fourth muscle of mastication is attached just above the angle of the mandible on the inner aspect of the mandible, okay. So internal surface of the ramus of mandible, just inferior to that of the mandibular foramina, okay, which gives passage to the inferior alveolar vessels and nerve. So this is a rough area attached to the, giving attachment to the medial pterygoid. So medial pterygoid, then it is the masseter, then it is the temporalis, and this is the lateral pterygoid muscle. These are the four muscles of mastication, and all are inserting here. As soon as you will say the all four muscles, they gain their insertion on mandible, then he will ask, I think definitely he should ask, why all these four muscles of mastication they are inserting, why not they are originating? Your answer should be that mandible is only movable bone in the skull, okay. The lower jaw is only movable, the upper jaw is fixed, and hence for the masticatory movements, okay, the jaw has to move because the upper jaw is fixed. So that's why the insertion are here, because the muscles can move the mandible at the temporomandibular joint. Then he can ask you the relations of the nerves. For the nerve relations, you can see that the auriculotemporal nerve is just in relation to the neck of the mandible on its inner aspect as it is going towards the temple or the temporal fossa. It is going, yes, this is the auriculotemporal nerve. Then you can say that and the notch coming out and going deep to the masseteric muscle or the masseteric nerves and the vessel. And then the inferior alveolar nerve is going into the inferior alveolar foramina this mandibular foramina, and this will come out through the mantle foramina on the outer aspect. So in the canal passing through is the inferior alveolar nerve. Then you can also say that there will be the, the nerve that is lingual nerve. You can say about the lingual relation of lingual nerve. So these are the nerves which I am telling, they are in directly contact with the bone. The lingual nerve is just inferior to that of the third molar tooth socket. If molar tooth is there, you can draw here just below the posto-inferior here in this part. Okay, this is the site for the lingual nerve relation. It is lying directly in contact with the bone. That's why a dentist has to be careful while removing the last molar. He may damage to the lingual nerve. He can damage. Okay, then he can ask the relation of some of the vessel. The maxillary artery is in relation to that of the neck of the mandible. This is the site close to the auriculotemporal. This is the maxillary artery site, where on medial aspect of the neck of the mandible it is related. Then it can give a branch, that is the inferior alveolar artery, which will go into the mandibular foramina. He can give, this will give, and another artery here, that is the masseteric vessels, which will go to the masseter. And lastly, you can say that the facial artery is in relation here to the lower border of the mandible, okay, or the base of the mandible. There is the relation of the the facial artery. Okay, it is the facial artery which is related in front or at the junction of the ramus and the mandible, just in front of the attachment of the masseter bone, masseter muscle. This is the site where the facial artery can come in, where the facial artery pulsation can be felt. So these are the important artery. He may ask you also, which are the ligaments attached to this bone. You can say that the lingula is near on the anterior margin of this mandibular foramina, which is a bony projection. It gives attachment to the sphenomandibular ligament, which comes from the sphenite process on the base of the skull. And then you can say that a strong ligament is attached at the angle of the mandible, extending on the posterior border of the ramus of the mandible at this place, and this is the stylomandibular ligament. And then on to the lateral aspect of the neck of the mandible, there is the attachment of the lateral ligament of the temporomandibular joint. I hope that I have covered all the bony relations which are in direct contact with the bone. For example, here the mantle nerve is coming out through the mantle foramina here. Okay, so I think I have completed almost all. And the mylohyoid nerves, okay, they are in vessels, they are in the mylohyoid groove, and it's another relations. Thank you very much for watching this second video on the mandible, its relations.